we are getting you a story from the Union Territory of Andaman Nicobar Islands, where the total number of cases has now gone up to 27. And after the Union Territory managed the control of the COVID spread, the cases have now seen a sharp rise in the past 1 week. To tell us more about the situation in the Union Territory of Andaman and Nicobar Islands, we have the Andaman Chronicle's Denis Giles joining us live on the broadcast. We will be introducing him and getting an update. Denis, thanks very much for joining us. Can you tell us the situation there in Andaman Nicobar? Because earlier we did see a spread happening and most of them were linked to the Delhi event. And now, after a very long time, we're seeing coming back of many such cases. Can you tell us the exact scenario that is prevailing in Andaman?
Yeah, the situation was all good with the early 11 cases. We had 11 cases in total initially, which started with the last flight, which landed on 24th to Andaman before the lockdown. So this had brought some around 9 people who were involved with the Tablighi Jamaat in Delhi, who had returned to Port Blair. And then it spread to 2 more people. But finally, the situation was very well under control, with all of them turning negative, all of them recovering from the disease. Now, it was on the verge, Andaman was on the verge to declare as COVID-free zone. And the very next day, we got a positive case, which was totally surprising for the islanders and the administration, because there was absolutely no clue as to where this particular person has been infected. So with the 12th case, Andaman has seen a drastic increase in the number of cases. And today, as on yesterday, it was the 18th case positive, apart from the earlier 11, which was tested by the Regional Medical Research Center in Port Blair. So now, as a precautionary measure, the Andaman Nicobar administration has tightened the lockdown rules for the South Andaman district, wherein the provision shops, essential commodities and things, it will be issued to the general public 4 days a week, and 3 days it will be complete shutdown.
Denis, if you're talking about the current scenario, because even when it comes to contact tracing, testing, and we see that the links of certain members of a same family that it had been reported earlier does not come in contact with the other people as well. How are you managing that kind of tracing? Because it all depends on ramping up testing and tracing measures.
Yes, the thing is, like the new set of cases which emerged, it was on the 17th with the 12th case. So it is likely to be linked with a family member who had arrived a day before. I mean, like on 21st of April, he had arrived from Chennai. So initially, according to sources, like he had some, this man who is a relative, elder brother of the 12th man, he was having some signs and symptoms for which he had visited the community health center, and he was given normal medicines and asked to stay at home. But later, though this man has been tested negative now, but later it is like getting tallied. I mean, like the link is, the suspicion is more on the elder brother who had arrived on 21st. But we cannot also rule out the possibility that the initial 9 people who were affected might have got it infected, spread the disease. Because like the situation now, as of today, is like apart from this 12th man, all the remaining people, that is 17 people, are asymptomatic. They have no signs and symptoms of COVID-19. Though they have been tested positive. So
that becomes even a growing concern because of those people who are asymptomatic and are not showing any signs of breathlessness, high fever, or even, when it comes to the symptoms of coronavirus that can be seen in other critical patients. This is even a concern that grows even in an island like Andaman Nicobar. Denis, Giles, I have to thank you for that. Thank you very much for putting across that information. So 27 are the cases, and there is a sudden spike, a surge that has been seen in Andaman. Denis, Giles of the Andaman Chronicle joining us here on the broadcast. Thank you very much.